Hello, I am Dr. Shazly Bari from Dhaka, Bangladesh. I, along with my co-author Dr. Irin Hossain, welcome you to the presentation of Gender Disparity in Management of Tuberculosis Patients among Garments Workers. Tuberculosis is a major communicable disease causing an enormous burden of morbidity and mortality worldwide. In 1993, the World Health Organization (WHO) declared tuberculosis a global health emergency. It causes ill health among millions of people each year and ranks as the second leading cause of death from infectious disease worldwide after human immunodeficiency virus (HIV). 95% of the cases and deaths occur in developing countries, and TB accounts for approximately 7% of all deaths in developing countries. Bangladesh ranks 6th on the list of 22 highest burden TB countries in the world. According to WHO TB report of 2015, the incidence of tuberculosis is 225 in 100,000 population in Bangladesh. Most of the tuberculosis cases and deaths occur among men, but the burden of disease among women is also high. In women aged between 15 to 44 years, tuberculosis is the third most common cause of morbidity and mortality combined, and tuberculosis kills more women than any other infectious disease, including malaria and AIDS. It has been estimated that tuberculosis causes more than twice as many deaths among women of childbearing age as does maternal mortality. In 2014, an estimated 2.9 million women fell ill with tuberculosis. Men have a higher prevalence of tuberculosis infection than women, but the prevalence of disease is the same or greater in women. This suggests that women are more likely to progress from infection to disease than are men, at least at some ages. Tuberculosis mainly affects women when they are economically and reproductively active. The impact of the disease is also strongly felt by their children and family. In the following poster from Stop TB organization, it can be seen that 1.4 million people died from tuberculosis in 2010. Among these, one-third were women. In prospective studies of tuberculosis-infected individuals in developing countries, it was found that females in their reproductive years had a higher rate of progression to disease, a higher case fatality rate, and a higher mortality rates. Garments industry is the largest export earning sector in Bangladesh. It is employing 4.2 million garments workers who are mostly female. Due to overcrowded and unhealthy atmosphere, Bangladeshi garments workers are 2.4 times more likely to develop active TB than general population. A TB patient loses 3 to 4 months of work time, resulting in average lost potential earning of 20% to 30% of annual household income. Larger gender disparities in tuberculosis detection and diagnosis persist, with a female to male ratio of 0.38 compared with 0.51 in Southeast Asia and 0.71 worldwide. In spite of considerable effort, larger gender disparities in tuberculosis detection and diagnosis persist in many countries. The following figure shows the estimated number of tuberculosis deaths among women in Southeast Asia in 2014. Being the biggest contributor to the country's foreign exchange and employing around 4.2 million people, the importance of the garments industry cannot be emphasized enough. Young women, who are the driving force of this garment sector, mainly belong to low-income families. They mostly suffer from malnutrition. Moreover, most of the garments are overcrowded, thus cramped working conditions and poor ventilation facilitates the spread of tuberculosis. It can lead to catastrophic out-of-pocket expenditure and cause patients to lose an average of 3 to 4 months' wages due to illness-related absence from work. Thus, tuberculosis causes loss of productivity and loss of GDP. If there is excess delay in tuberculosis management, there will be more chance of rapid spread of tuberculosis among the garments workers in highly dense working conditions. These studies will find out the factors related with gender difference in tuberculosis management. It will help planners and policymakers to take urgent actions to reduce the vulnerability of tuberculosis by reducing gender discrimination. General objective of the study was to find out the association of gender disparity with tuberculosis management among garments workers. Specific objectives were to determine gender disparity in delay in diagnosis and treatment of tuberculosis in garments workers, to assess gender difference in perception of TB awareness among the garments workers with TB, to find out factors related to gender disparity in management of tuberculosis patients among the respondents, to find out the socio-demographic characteristics of the respondents. It is a cross-sectional study which was conducted in male and female garments workers who were diagnosed tuberculosis patients. It was conducted in Dot Center in Savar Upojela Health Complex, Tongi Upojela Health Complex, Bragg Dot Center, Uttarkhand and Dakshinkhan in Uttara. The study was conducted in 2014. The sample size of the study was 171. The sample was selected purposefully. Pre-testing. A draft questionnaire was developed according to the objectives and different variables of the study. Prior to data collection, the questionnaire was pre-tested and after that it was modified and finalized. Research instrument. A structured questionnaire along with checklist were prepared. Some questions from WHO diagnostic and treatment delays in tuberculosis were included in it. After taking written consent from respondents by introducing and informing the study purpose and objectives, data were collected by face-to-face interview, ensuring privacy and confidentiality by using the questionnaire. After collection of data, these were checked to detect errors, omission, and edited for consistency. Respondents were asked 6 questions regarding perception on TB using Likert scale. Then answers were accumulated for the measurement of perception using SPSS analysis, dividing perception level to 3 groups: poor, below average, and average. Independent student t-test was used to determine association with delayed diagnosis and treatment of tuberculosis. The age of the respondents ranged between 15 and 52 years, and about half proportion of the respondents was in group of 21 to 30 years. Out of 171 respondents, more than half of them were female and one-third of them were male. About 62% of the respondents have education up to primary level, while 38% have education above primary level. Most of the respondents' income were between 5,000 and 10,000 taka. Average perception regarding TB awareness was higher among the respondents with education level above primary, while poor perception was higher among the respondents with education level up to primary. Majority of the respondents had job, while 29% of the respondents didn't have job while the study was conducted. Most of the respondents informed that their working place was highly tense, while 11% said it was not tense. Regarding the status of working place, about half of the respondents did not inform the authority, while 9.9% were sacked from the job, only 1.2% were separated from the other workers. About 21% of the respondents got help from their authority. Of them, 94% got leave for sickness, while 5.6% of the respondents got financial help. Education was significantly associated with perception on tuberculosis awareness, while gender difference was not significantly associated with perception on tuberculosis awareness. In case of tuberculosis diagnosis, mean days in delays in diagnosis is higher in female than that of male. Though delay in diagnosis was significantly associated with gender disparity, treatment delay was not significantly associated with gender difference. The obtained data warrant more gender-sensitive intervention for tuberculosis control in Bangladesh, especially given our national commitment for attaining the Sustainable Development Goals. Over the last couple of years, interest in identifying and addressing gender issues in TB control program has increasingly been growing. World Health Organization (WHO) and Training in Tropical Diseases (TDR's) Task Force on Gender-Sensitive Interventions (GSI) have started to work together and develop approaches to identify and address gender issues in tuberculosis control. Cultural epidemiological techniques, together with complementary methods, are useful in measuring the scale of gender differences and eliciting insiders' view about the role of gender vis-à-vis gender barriers to tuberculosis control programs. The consequences of tuberculosis in women are far-reaching, affecting women themselves, their children, and the society in general. In such scenario, gender disparity in management is an important issue. Thus, the obtained data will provide guidance to the public health expert for overcoming barriers to effective prevention, coverage, and treatment of tuberculosis. Following steps will help towards removing such gender differences. First of all, examine the causes underlying any gender disparities to understand the extent to which these are biological, sociocultural, or operational. Interactive and effective social communication-based health education covering all aspects of tuberculosis, particularly women's health and their TB-related vulnerability and their special needs and circumstances, ought to be designed and implemented using different media such as interactive popular theater, folk songs, and mass media. Gender considerations regarding health-seeking behavior, outcomes of a positive tuberculosis identification, and so on must be integrated in these health education programs. There should be incorporation of gender issues in training curriculum for service providers and TB program managers. Health checkup system in garments factory should be improved and expanded to include detection of tuberculosis on priority basis. DOTS should be implemented in working place, particularly where cluster of workers working together. Smear positive patients should be asked to abstain from work in conversion. Moreover, from ethical point of view, the employers should be convinced not to terminate the tuberculosis patients if detected from their job. They should be allowed to work after completion of intensive phase or sputum conversion. Otherwise, they will refrain from seeking health care in fear of losing their jobs, which will be detrimental to the society. Thank you for patiently listening to our presentation.